Good morning, my name is Jocelyn Bruneo and my topic is female genital schistosomiasis. I attend Catholic University Santiago de Guayaquil and these are my social media profiles. Definition: female genital schistosomiasis is a manifestation mainly of a schistosome infection. Given the nature of the signs and symptoms of female genital schistosomiasis, women tend to approach health services with complaints of infertility or symptoms of sexually transmitted infections. Schistosomiasis, also known as Bolsaria, is a disease caused by parasitic worms. The parasite that causes schistosomiasis lives in a certain type of freshwater snails. Applications in medicine. Causal agents. Schistosomiasis is caused by some species of blood trematodes in the genus Schistosoma. The three main species infecting humans are Schistosoma emetovium, Schistosoma japonicum, and mansoni. In the picture, you can appreciate the Schistosoma life cycle. Geographic distribution. Schistosoma mansoni is found primarily across the sub-Saharan Africa and some South American countries such as Brazil, Venezuela, and Suriname, and the Caribbean with sporadic reports in the Arabian Peninsula. The others, less commonly human-infecting species, have restricted geographic ranges. Clinical presentation. In women, the symptomatology is unspecific because urogenital schistosomiasis can provoke gynecological ailments. The most frequently observed signs and symptoms are abdominal and pelvic pain, presenting in forms such as dyspareunia, dysmenorrhea, leukorrhea, menstrual disorders, postcoital bleeding, or simple contact bleeding during an examination, for example, cervicitis, endometritis, and salpingitis. The disease evolves most often in a chronic manner. The typical genital changes, such as sanded patches and the pathological blood vessels, may make women susceptible to super infection, causing contact bleeding, decreased fertility, abortions, discharge, and bleeding. Further research is needed to find simple, low-tech diagnostic methods and treatment for chronic lesions. The pros and cons. Pros. Safe and effective medications is available for treatment of schistosomiasis. Rarely, eggs are found in the brain or spinal cord and can cause seizures, paralysis, or spinal cord inflammation. Regular treatment with praziquantel from an early age prevents schistosomiasis from progressing to genital damage and other related complications. Early treatments, especially in childhood, is the most effective intervention to prevent the occurrence and development of complications associated with urogenital schistosomiasis. Cons. Although the clinical manifestations on the urinary or gastrointestinal tracts are widely known, many clinical healthcare professionals are unaware of the genital manifestations, which are often ignored or underestimated. The biological plausibility of a causal association between genital schistosomiasis and HIV has been described and may be an important factor in increasing the risk of contracting HIV in areas or communities where both infections are endemic. Genital schistosomiasis may be associated with the presence of a schistosome X, also known as ova, in the genitals in both men and women. However, ova are not always present, and current laboratory methods have a low sensibility to confirm their presence. Lesions associated with genital schistosomiasis may mimic a host of infections and premalignant and malignant conditions. It is therefore crucial to identify alterations that are pathognomonic. Issue applied in Ecuador. Schistosomiasis in Ecuador. According to the WHO data latest publication from 2018, there were no deaths caused by schistosomiasis in Ecuador, which gives us a 0%. Therefore, Ecuador occupies the 183rd place in the world. Conclusions. Human schistosomiasis remain an important public health problem in many tropical settings. At least 261 million people require treatment for schistosomiasis, and up to 659 million people are at risk. The pathophysiology and immunology are imperfectly understood. Appropriate diagnostic tools are not at hand. Therapeutic rationales do not exist. The natural history is not well known, and women's perceptions of their illness has never been studied. The widespread lack of awareness of genital schistosomiasis leads to misdiagnosis and false and infected therapy. Incorrect diagnostic of genital schistosomiasis lesions frequently leads to debilitating and irreversible operations such as ovarectomy, salpingotomy, and hysterectomy. Here is a video which will explain what I just said. Thank you very much for watching.